And our mission statement that OBI has is to be the donor-to-patient lifeline, providing our communities and medical partners security by meeting transfusion and healthcare needs.
I'm going to step closer just since she's recording, so I'm just trying to help.
I finally got it to work, sorry.
Oh, you did?
Yeah.
Great, okay.
And this is one of our patients that we had. It was a 20-year-old hunter. He received blood from 2 donors after he had a 4-wheeler accident and needed some blood. And then Jonathan, on the left, he was a donor who just happened to be giving blood at Muskogee High School. Didn't know that he was going to be saving some lives, but his blood went to Hunter, and now he is a walking, talking testimony. I don't know if y'all know, but that the need for blood is constant, ongoing, and it's crucial. And there's no substitute for human blood. Supplies must be constantly replenished since red blood cells can only be stored for 42 days. Here's a little bit of statistics. 1 in 3 people will need blood in a lifetime. Every 2 seconds, someone needs blood. And then healthy adults 17 and older can donate who weigh 110 pounds or more. Those who have had surgery can give 2 weeks after recovery, and the non-blood related cancer survivors can give 1 year after being cancer-free. I know y'all will probably be asked numerous questions about that at the blood drives.
For eligibility, if you have questions, feel free to call into the center or look online at obi.org or James. I think you guys have cards for me and for James. My card is on the inside of the folder. We don't mind answering questions, and I don't always, or I never know all the answers to those questions, but I can find somebody who does.
I usually have somebody close enough I can
Ask. Yeah. Okay.
Yeah. And less than 5% of those who can give actually do. So we're trying to get that statistic up. And we are. It takes about an hour, costs nothing, and you can donate red blood cells every 56 days, plasma every 28 days, and platelets every 7 days. The next slide, a little bit about OBI, meeting the need. We are the 9th largest independent nonprofit regional blood center in the U.S.
And let me talk a little bit about nonprofit. Blood is kind of like water. It falls from the sky for free, and actually for us, donors come in and they donate of their time for free. But we do charge hospitals for blood, just like the other blood provider in this area, and we do it on a cost recovery system. So like I said, like the water falls from the sky for free. You don't drink it for free. You paid for it to be tested and to be purified and to have all those things done to it. Our hospitals pay us to do the HIV testing and the HCV testing and to make sure that it's safe to be transfused and to split it into its components and those sorts of things. So if anybody tells you that there is a charge for blood or somebody charges for blood, everybody does. They don't really charge for the blood itself because that was a donated item. They charge the cost recovery of what it costs to take care of making that unit safe for transfusion. So just clarify that a little.
Yeah.
And I'm just going to jump on that and say that what she's saying is that every blood entity in the United States does the exact same thing.
A cost recovery.
And every unit of blood product that goes to the hospital must show as a volunteer blood donation or it's not acceptable. So just kind of wanted to
It's
jump
required by the
from that.
FDA
Yes.
actually to do that. And when you hear of people who pay for plasma, when they're paying for plasma, it doesn't directly go to a patient in a hospital. They actually have to treat it and purify it and do other things to it. And that's why they're allowed to pay for it. And the criteria is a little bit different for the plasma donors. They do use those things to create drugs, make vaccines. So it is saving lives as well, but they actually are a for-profit entity in that respect.
Awesome. OBI, we collect nearly 250,000 units of blood a year from 250,000 volunteer donors, just like you guys. We employ nearly 700 staff, served by 800 volunteers and 2,600 blood drive coordinators. Every patient in around 150 medical facilities throughout Oklahoma, Northwest Texas, and Western Arkansas who need blood rely exclusively on our donors for it. Approximately 85% of all blood products used in Oklahoma and approximately 8 out of 10 Oklahomans who need blood get it from Oklahoma Blood Institute.
Do you want me to talk about this?
Yeah.
Their governance? Okay. Where OBI is concerned, we are an Oklahoma company. We're incorporated in Oklahoma. Our FDA, Food and Drug Administration licensure clearly states Oklahoma on it. We do have a couple of facilities, one in Fort Smith and one in Wichita Falls, Texas, and another in Hot Springs that have the names of Arkansas Blood Institute and Texas Blood Institute, but they're still incorporated under the Oklahoma Blood Institute Corporation. All our executive management and board functions are in Oklahoma. Our CEO is in Oklahoma City. All of our policies and procedures are dictated from that corporate level here in Oklahoma. And we are inspected by lots of places. The Food and Drug Administration is our probably largest inspector. They treat us as a pharmaceutical, so we're inspected just like somebody would inspect Pfizer or somewhere else. So we're inspected on that high of a criteria for producing a pharmaceutical. We're also compliant with the American Association of Blood Banks standards, which they have an even higher standard in the Food and Drug Administration on requirements for blood banking. And those are just some of who come to check on us on an annual, sometimes semi-annual basis. Also, drug enforcement agencies, the pharmaceutical boards, since we have medical staff on hand, things like that. But we just want to make sure that you all know we are fully compliant and fully registered with the Food and Drug Administration. We have never had any fines. We are currently under no consent decree, which they issue if they find problems with anything. And we are ISBT compliant for blood product labeling, which is a requirement put forward by the American Association of Blood Banks about 4 or 5 years ago, that every label look the same on a unit of blood, so that if a unit of blood were to go to out of the country, it's an international standard, that the expiration date is in the exact same space on this unit as it is over here, and that the barcode readers in Australia can read the barcodes here the exact same. It makes it so that it's kind of a safety standard so that blood can be moved around if there were a disaster and it would need to be.
And the next page is the service area and the donation area that OBI services. I had to squeeze that on there, but I got a better map in your folder. There's another map of Oklahoma, if you want to look at that better. But the purple and blue indicate where donors get blood through OBI and Texas Blood Institute and blood drives. And then areas in purple indicate counties where more than 150 medical facilities receive blood from these patients supplied by these donations. So we've got them, the closest to you guys is Tulsa. We've got a Tulsa Donor Center. We've got one in Wichita Falls. We've got one in Ponca. We've got one in OKC, Enid, Lawton, Ada, and Ardmore. And there's a couple more in there. This one's not as updated. But so we supply strictly to Oklahoma donors and the outlying states around.
Let me clarify that just a little bit. With anything in healthcare, you have to make sure that you have an excess capacity for an emergency. So we do over-collect, and if for some, you definitely don't want to take somebody's donation and waste it because you've over-collected just to make sure you have it for an emergency. So if for some reason we were to over-collect, after we've taken care of all of our regional hospitals, which would be the ones here in Oklahoma as well as Northwest Kansas and Northwest Texas, we will what we call export that blood out to places that may not have blood at that time or having some other reason that they need some help. We helped with the hurricanes I guess it was tornadoes up around New Jersey and those sorts of things. So we do have it and we're willing to share it when it's needed, and we definitely will do that rather than let something expire on our shelf. So we do send things out of the state. I want to make sure that's really clear. But our focus is Oklahoma and definitely taking care of our Oklahoma hospitals first. If you look like you have a question.
And just to kind of jump a little bit on that, because I know that sometimes in my experience, I'm like, well, I thought I'd stay local, and you guys have an office in Fort Smith, Arkansas, so does that mean that our blood's going to Arkansas because we don't want it to, kind of thing? Our Arkansas Center is very self-sufficient. They draw plenty of blood to supply the Arkansas hospital. So